Thank you all so much for being here. I'm actually going to pull my slides up. This is the second in our three-part series on our bills. So appreciate you all being here. Some of you may have been here for our one a couple of weeks ago on the workforce, but really excited to be talking about our health equity bills today. So we're going to just dive right in the interest of time. So again, we had our first one a couple of weeks ago on the workforce bills. Today, we're going to be talking about the 4 bills in our health equity category. And I'll talk a little bit more about these categories in a minute. And then hope while you're on today, you will be inspired to sign up for the last webinar on our bills around community inclusion and empowerment. We have held previous webinars on our platform as a whole and our process to set priorities, but want to really focus today on the 4 bills in this health equity category as we move into the kind of hearing season and as bills are really starting to move forward. But before we go much further, wanted to just introduce myself for those of you I haven't met. My name is Nora Bent, and I'm the Director of Government Affairs and Strategic Partnerships here at the ARC. And we're also joined today by our CEO, Maura Sullivan. I don't know, Maura, if you want to say hello.
Hi, everybody. I'm so glad to be here for this health equity webinar. As you know, this has been an area of focus for the ARC and for me personally. So I just came to jump in on Nora's webinar and talk a little bit about some of the history and context around some of these bills, but also how it intersects now with some of the federal policies that we're seeing coming down, the impacts on Medicaid. So just happy to be here.
All of these bills are secretly Maura's favorites, so no
Not
favorite
secretly.
children, no favorite bills. Alrighty, so a quick overview of what we're going to do today. I'm going to start off with just a quick refresher on our priority setting process, and then give a little snapshot of where we are in the legislative process, both as kind of context for our discussion today. And then I'll talk about this category in general and highlights of each of the 4 bills in this category. And then we'll give you lots of resources and ways to get involved in advocacy on those bills, and then have lots of time for questions at the end. As I'm going through, please put questions in the chat and we'll try to get them all at the end unless it's urgent, or if I say something crazy and you want to call it out, feel free to do that as I'm talking. And then we'll share all of the slides and resources with you at the end of today's webinar. Okay, so how did we get here? Some folks may be familiar with this, but just to kind of level set where we're starting from. So this past fall, the end of 2024, as we wrapped up one legislative session and prepared for a new one, which started in January, we underwent a really thorough priority setting process. In Massachusetts, we operate on 2-year legislative cycles, and the end of one and beginning of another brings a great opportunity to review where we were successful, what we need to change our focus on, and kind of take a step back and think about how we're being really strategic in our priority setting and running through our priorities. So we did that this past fall and in advance of the session starting in January, and really wanted to make sure we were including our community and the chapters of the ARC and being attuned to what was happening at the state and national level. So we held a community survey where about 600 people responded to share what issues were top of mind, where they thought we should be focusing, what bills felt relevant. And we surveyed our chapters as well to get a sense of what they were seeing on the ground. How do we make sure we're coordinating with them? And then, of course, reviewing the state and national landscape on the state level, thinking about what the fiscal environment is, what bills have been successful, what bills have struggled, how do we kind of review our strategy on those. And then, of course, the national landscape, which changed quite significantly as we were going through this process, thinking about what the proposed Medicaid cuts and other challenges currently happening at the federal level, what that means for the state and how we need to be attentive to that, both in terms of setting our priorities and our strategy on each bill. The picture on your screen is our attempt to, in very colorful sticky notes, put these bills and topics into buckets. And that's how we landed on these 3 priority areas: uplifting the workforce, health equity, and community inclusion and empowerment. Each category has a set of bills in them, but those are really the big overarching topic areas that we are focusing on and are really kind of true to the Heart's mission, the ARC's mission and the work that we do as kind of the top three areas that our work falls into. And then to zoom out and talk a little bit about where we are in the legislative process, if you have joined one of our advocacy trainings or other webinars, this slide might look familiar. I'm not going to go through it in a lot of detail, but just to give some context as to where we are in the State House. As I mentioned, we operate on 2-year cycles in Massachusetts, and we're at the very beginning of year 1 of 2. So at this point in the session, bills have been filed in January. Bills have been sent to the appropriate committee based on their subject matter for review. And as I mentioned earlier, we're actively in the process of hearings being scheduled. We just had one a couple of days ago on one of our priority bills. And that's a great opportunity to provide testimony as an individual or as the ARC to really make sure the committee is hearing what the top concerns are and why these bills are so impactful. As you can see on this, there are many more steps in the process, and it can often take the full 2-year cycle or even multiple sessions. So this is really all about persistence and being attuned to where we are in the session and kind of coordinating our advocacy based on that timeline. So we're not going to go in much more detail on this today, but encourage you to reach out if you have more questions about this process or join one of our advocacy trainings to take a little bit of a deeper dive. All right. So starting off with this big category, health equity is, I think, so obviously critical in this time and in this work. And that's a huge category, right? There could be a million things that we cover. But to really center what we're talking about here, I think we all understand that healthcare is a really fundamental human right, but we know that gaps exist for marginalized communities, including people with autism and IDD. And many interact with a system that makes it really hard to find providers who can treat and understand and meet their needs or find adequate insurance coverage. So our bills in this category really seek to improve access to quality care and insurance coverage and make sure the healthcare system is inclusive and meeting the needs of our community. That's a big bucket. So these 4 bills really try to take kind of a piece of that and make some progress on more specific issues. And with that, I will turn it over to Maura to cover 2 bills, and then I'll cover 2 bills, and then we'll go into questions.
Great, thank you, Nora. I hijacked this webinar because this bill in particular is one of my favorites, and I think it has a really great chance to pass this session. We were really close in past sessions, but just some nuances came along in the legislature to knock us off track. But in general, this bill called Healthcare Standards, which used to be called Hospital Training. And before that, if you remember, it was called Autism Teams in Hospitals. So it's had many renditions and the language has changed quite a bit over the years. I actually picked this bill up from Senator Barbara L'Italian way back when she was the government affairs director at the ARC and then moved on to be a senator. And I was lucky to get sort of the basic bill from her. But as we moved forward in the different sessions, we realized the bill needed to be a little bit broader than just building autism teams in hospitals. And we wanted to really provide full standards of care for all clinicians and continuing education. And we came to that because as we were working through our success with Operation House Call, we realized, that once these doctors are out and practicing, they really need more tools. It's great to educate them during medical school, but when they're actually hands-on treating patients, they need standards of care and lots of continuing education. So we rewrote the bill with the MassHealth and Hospital Association to include all of that and to really focus on how we would come up with that continuing education and healthcare standards. would be through a commission that actually had stakeholder input, including individuals and parents in the disability community. So we're excited about this bill. Over the last couple sessions, we've built tons of support for it. Last session, we held a briefing at the State House, and we had Boston Medical Center there supporting the bill, Children's Hospital supporting the bill, MassHealth and Hospital Association, since they co-wrote the bill. And we also have healthcare for all now, Nora? Yeah,
Yep.
and we're working on MGH too. They just haven't finalized it yet. So we have really good support. What I think really comes through in the hearings is the fact that, families and individuals still face a lot of discrimination in healthcare, trauma when they go to the emergency room. They have issues of access. Really a lot of folks that are undereducated in how to treat patients with autism and IDD. And, if you're interested in learning more about the bill, our fact sheet is great on this one. And, one of the things that stands out so clearly is that only 40% of doctors feel competent to serve individuals with autism and IDD, right? So we really have to make an impact on that, because if they don't feel confident, and they're not going to be competent to do this. So we really need to get that education going. So yeah, any questions on this bill? Did I hit on everything, Nora?
Yeah, I would just add one piece that you alluded to, but there was some language added this session specifically around emergency department boarding. So when folks are really kind of stuck in the emergency room for days at a time, that is a horrible experience for anyone, but thinking about how that's uniquely challenging for the disability community and their families. So that's a newer addition, but one that's in line with the original part of the bill and in line with so much work that the state is doing at the moment.
Yeah, actually, that's true. That's two things that we've added, and one of them being really focusing on intersectionality in some of that training as well. So yeah, those are the two new pieces. So great. So thank you. Hopefully that hearing will come up soon. And speaking of hearings, if people have not heard this bill, the MassHealth ABA Coverage bill, does have a hearing coming up. Let's see, I think I had it prepped. I'll stick it in there. This Tuesday, actually, July 1st. So coming right up if you're interested. But again, any of these bills you can always start some written testimony and have it ready to go. Nor maybe at some point you can talk about the written testimony piece and how to submit it. But this is another bill that has just incredible support across the state, from families to providers, to individuals that come and testify, because it's truly an area of inequity. So when you turn 21, if you have MassHealth, you no longer are able to have ABA coverage. Nothing changes in your needs necessarily from age 20 to age 21, but that coverage is dropped. So we've been, focused on this bill as a true equity issue. But it's also adding to that cliff that individuals face when they turn 22. And as we saw, with the workforce shortage, so many folks not having day programs, many are able to fall back on their insurance coverage and actually get ABA coverage in a clinic and have programming and supports if they don't have a day program, but not if you're not lucky enough to have private insurance. So it's become even more critical in these days where we're seeing so many adults unserved by day programs in Massachusetts, that they can have access to ABA just like folks who have private insurance. So that's been the big push, and it does have a lot of support, but I will say that any bill this year that it requires Medicaid funding is going to be an uphill battle, given the Medicaid funding that that is already kind of tightened here in the state. I don't know if you've heard, but we're really looking at how to keep PCA cuts away. And obviously, Dahab and other areas have been flat or slightly decreased this year. So very concerned about that, but it doesn't stop us from really pushing the need for this policy to be addressed. And of course, the AAC for adults is part of this bill as well. Any questions on the ABA? Did something come in the chat there, Nora? A fiscal note yet? What exactly do you mean by the fiscal note, Kelly?
The cost that it will add to Medicaid.
Oh, yeah. I think it's been really difficult to figure out the cost because what they're doing is looking at sort of the entire population of 14 to 22 and trying to take that number and put it into, what it would cost if those people had ABA after 22. And, we've been trying to be a little more carved out in the way we look at the cost. But overall, yes, the cost has, shown MassHealth to be prohibitive, although at this time. But I will say that this year, and I don't know if people are aware of this, in the budget, and I think it was actually during the informal session, Nora, there was a bill passed that allowed people with Down syndrome to get ABA coverage. And this was a huge policy breakthrough, right? This was wonderful, and the MDSC led that charge. So there has been movement. So, I think in general, that is a lesser cost. But again, any work we do will definitely involve like a really significant financial analysis.
Thanks.
Okay.
Alrighty, gonna move on to the next bill, and then we'll have lots of time for other questions that you think of as we keep going. So this bill around preventing discrimination in healthcare actually had a hearing, I think last week, with really incredible support from the ARC and other organizations. It was a packed hearing with a lot of bills on the agenda, but this is definitely one that got some good attention. So really glad to see that. And this is a bill that acknowledges the reality that discrimination against the disability community in healthcare settings is real and pervasive and dangerous. It comes out of the COVID pandemic when the crisis standards of care, which folks may remember, deprioritized people with disabilities from receiving the life-saving care that many needed with the pandemic. That is, of course, not the only time there has been discrimination in healthcare. It's an ongoing challenge. But I think the COVID pandemic really exposed how pervasive and dangerous it can be. And the ARC was really active during that period to work with other organizations in getting the crisis standards of care revised, training emergency room doctors and providing resources because it was such a critical moment to kind of stand up and provide real resources and opportunities to understand the value of people's with disabilities lives and why this deprioritization is so dangerous and how pervasive it really is. So this bill takes all of that, the lessons from that period and the ongoing challenges to create policies to ensure that people with disabilities are not deprioritized in future public health crises. God forbid we have a future pandemic, making sure that we are really learning the lessons that we learned from COVID and moving forward positively. The bill also takes a more proactive approach in expressly prohibiting discrimination against people with disabilities in healthcare settings, as well as establishing protections to prevent disabled patients from being pressured to sign do not resuscitate orders. I think this bill is such a good example of taking a really horrible, tragic moment and thinking about how do we move forward and establish protections. And especially in the current environment and the current federal administration, I think the fears are really rising of the understanding of the value of disabled individuals' lives, and some of the rhetoric and challenges we're hearing from DC, I think, are causing some anxiety and concern. And this bill is a really good, policy move forward, as well as an important statement for Massachusetts to make that, this is not tolerated, and we do not kind of condone what is happening in at the federal level. So again, this bill had its hearing last week, but it's definitely not too late to kind of get involved and share your stories. So we'll have information at the end of today on how to do that.
Yeah, and Nora, I just wanted to say this definitely these bills connect, right, in some ways, and I think the healthcare standards bill is really important, sort of on the implementation side of this bill, because back in COVID, when the crisis standards were revised, what we found was they can revive standards and guidelines, but what's really happening on the ground can be different. So if you listened in on the hearing last week, or if you've heard any of the hearings in the past, people were still being discriminated against even after the guidelines were changed. So we have to change the law, and then we have to also do that implementation follow-up and training. So the advocacy never ends.
And that's a really good point, and something that we really thought about in our priority setting process too, that some of these bills take on really specific topics and some are really broad and talk about training and other kind of more systemic challenges or opportunities. So thinking about how all of these bills work together, I think, is so important. And that's a big piece of our advocacy and communication to the legislature, to think about, how do we really make progress on these issues and do so much of this work collaboratively. Okay. The final bill that we're going to talk about today is Tommy's Law. This is a bill that is named after a young man named Tommy, who in 2017 tragically passed away in his group home after a nighttime seizure went unnoticed by the staff in his group home. He had relied on a seizure monitor for most of his life. And after a hospitalization or during a hospitalization, the seizure monitor lost battery and was not charged. So then when he returned home to his group home from the hospital, the machine was not operating properly and allowed this tragedy to happen. So this bill, another example of taking a really horrific and preventable moment and transforming it into positive change, requires that when an individual leaves a medical facility like a hospital, that their discharge plan and information on those life-saving devices is appropriately reviewed with the nursing staff in a residential facility. The bill also includes communication and notification procedures to other staff and caregivers, as well as requirements around learning to operate and fix these types of devices, so that, again, this type of a tragedy doesn't happen again. Maura, maybe you can speak to a little bit more of the context, but I think this bill has been filed before, and there is support for it, but yeah, go ahead.
Oh yeah, it's a long time supported bill, and Senator O'Connor has made this one of his top priorities, and we're so grateful to him. Just even more context around the really sad story is this seizure monitor was unplugged and the battery had run out, and no one had checked that when the individual was discharged back to his group home. There was also more to that around the discharge planning not being followed. And a lot of that had to do with the fact that it was, the directives were going to direct support professionals and not clinical staff. So this bill puts that into the regulations, and I think it's a really important step forward in safety in group homes. And we see a really high number of individuals with epilepsy living in our group homes and at home. So this is super important. Yeah, it's all life-saving medical equipment that would be covered under this. This is one of sorry, Nora, I was just gonna say one thing we didn't talk about, but this is definitely one of those bills that we hope to see sort of snuck into language in another bill because it is small. But we could find other healthcare bills and other ways to kind of get that language in. So Senator O'Connor and Rep. Rogers have been doing that, and they're continuing to look for ways to do that. They're both really strong bill supporters.
So I'm going to quickly run through these. As I said earlier, we, in our priority setting process, set our legislative priorities, which are the ones we're really focusing on in this series, but also have a set of bills that we've endorsed and support. But maybe another organization is kind of leading the charge and we are uplifting their work. So they're not maybe the focus of our conversation today, but also critically important and really speak to the partnerships that we hold and work to support with other organizations. So these bills kind of run the gamut in what they cover, from incentives for more dental providers that accept MassHealth over the age of 21, stronger consumer protections and warranty protections for wheelchair and scooter users, continuous skilled nursing care for medically complex children, and barriers to that treatment through MassHealth, increasing opportunities for medical providers who understand and are expert in autism, and really kind of so many other kind of topics on this list that again are on our agenda, and we are actively kind of working with the lead organizations and sponsors to support throughout the process. Okay. I'm gonna Actually, I'll run through this slide quickly and then we'll run to questions. Again, you'll get all of these slides at the end, so don't worry about jotting down links or anything like that. But if you go to our legislative platform webpage, we have fact sheets, contact information, tracking information, summaries, and pretty simple plain language fact sheets on each bill. So if you're looking to dive even deeper into any of these bills, we have some great resources on that webpage, as well as a link you can click on to see the status of the bill. But of course, you can also always reach out to us if you're interested in where a bill is in the process. And then every bill is also available on the Mass Legislature's website with similar tracking information. And then, of course, our action alerts, which the QR code is here on the screen to stay in the loop on what's going on. And we have about 14, 15 bills on our platform. So there are going to be some bills that really speak to you that you want to get more involved in. Let us know what those are, especially as hearings are being scheduled and there are more advocacy opportunities. We're keeping lists of who's interested in what bill so that we can really quickly reach out to you and say, the hearing is on Tuesday. How can we help you with testimony? Do you want to come to the State House? Can you contact your legislator? So if any of these bills are really kind of speaking to you and you have a really compelling personal experience with that you want to use for advocacy, definitely take some time to let us know, and we'll make sure you're looped into all of the advocacy work. And then just kind of finally, before we jump to questions, another plug for we've one webinar left in this series focusing on our community inclusion and empowerment bills in July. That's a big category, so that's going to be an interesting webinar, but that's kind of the piece that will round this out. But as always, all of the recordings will be available, and we have, again, great resources on our website for each of these bills. I will stop sharing so we can see each other, but I can throw back up a slide if we have any questions. I'm going to take a peek at the chat and see what questions we have not answered, but as I do that, if folks want to just raise their hand or yell out a question, feel free.
And Nora, I just wanted to say if we could touch on how folks could find out if their rep and senator are co-sponsoring any of these pieces of legislation, or even if they just want to check in and, make sure they are doing that.
Yeah, absolutely. On the Mass Legislature website, if you go to the bill page, it'll list all of the co-sponsors of the bill, and you can look for your legislators. And if you aren't familiar with who your legislators are, there's also a really helpful link on that same website where you can plug in your address and it will tell you who your legislators are. And definitely a great idea to reach out. And if you don't already know them or you're building a relationship, to reach out and introduce yourself, share a little bit about your story or your family, and share some bills that you're interested in. And if you're having a harder time kind of figuring out which of those, what bills you want to talk about, let one of us know, and we're happy to kind of walk you through what might be a good place to focus.
Yeah, I'm taking a peek at the chat to Nora and Lucy. Yes, I agree that the issue with the sitters is really complex. Um, they're definitely not well trained and often not equipped to really provide care, especially not, for some of the more complex individuals. Some of the hospitals have the navigators, which I think have been really, really helpful. People have really been able to rely on them when they're in the hospital and have problems, but not every hospital has them. The child life specialists are okay too, but they can only do so much, and they're not there for the adults.
I see another question from Lucy in the chat. Does each bill have its own pre-prepared letter to legislators? We don't have a pre-prepared kind of testimony for each bill, but we do have the fact sheets, which are painstakingly written with the right information and messaging. So those are really great things to pull from to think about kind of what details of the bill you might want to share. But as always, your own stories and experiences are really should be the bulk of testimony. Those are the best kind of data and examples to show why a bill is so important. Very soon, we will have some resources online about writing testimony, about sharing your story for advocacy. So those will also maybe be helpful in thinking about where do you start. And we're always happy to look at a draft or help you kind of think through what might be the best way to get started.
And when we're really pushing to get a bill out of committee, we will do action alerts for those bills. And you'll see sort of the summary that you can just add your name and write directly. Do you want to talk a little bit about the movement of bills this year and how it's kind of sped up a bit, which is good news?
Yeah, so the House and Senate are each I'm gonna get nerdy for a minute, but this is exciting for me. The House and Senate each have their own kind of internal rules that govern how they function, but they also have joint rules that govern how the House and Senate work with each other. And getting agreements on joint rules has been very challenging in the past, but this year, actually just as of this week, there was an agreement on some updated joint rules that have a couple of really important provisions. One is about notice of scheduling hearings. We will now get 10 days notice for hearings instead of 3, which is incredibly exciting. Just more time to prepare, more time to get people, rearrange your schedule, whatever you have to do. But the House has also included a rule that bills have to be reported out of committee 60 days after the hearing, with an opportunity for a one-time 30-day extension, so 60 to 90 days deadline. There is no similar requirement on the Senate side, but there has been a lot of talk and momentum about moving bills faster. It is great to see bills move out of that initial committee by that deadline and helps us kind of target our advocacy. But similarly, it'll be on all of us to be working as the bill continues moving through the process, that if it goes to another committee, that it doesn't get kind of stuck there. So still some sticking points that I think we'll have to be really attentive to, but that initial movement of getting the bill out of committee and moving through the process, I think is going to speed us up a little bit, especially for bills that have been around the block before and the committees are familiar with. Just last week or the week before, a bunch of the bills that we had just had hearings on, and the Children and Families Committee moved out. So excited to see some movement kind of earlier this session.
Yeah, if you missed our breaking news on that, it was the Nikki's Law expansion with the DPPC terminology, the archaic language bill, and that finally, and actually PCA prompting and queuing, and the definition of developmental disabilities. So kind of all of our bills from that hearing passed through, which truly gives us just so much more time to work with Ways and Means or whatever the next committee is, and have opportunities to get the bills into different vehicles, which is really what's been successful more recently for us.
Yeah, I think that's a really important point that it can be very challenging to get a single bill to move, especially some of these bills that are maybe smaller or feel like they're could be added to something else. So as we get into this part of the session where we're seeing bills pass and we're seeing committees package bills together that are related, our work is to make sure our bills are included in that, and if they're not, filing them as amendments to get them included on the floor. So this is where the process can start to feel a little messy and complicated and fast moving. So would encourage you to just kind of keep an eye on our social media, notes from the ARC, and truly reach out anytime. I'll throw my email in the chat and you'll also get it with the slides, but we're here to walk you through the process, think about where to start and what bills are of interest to you. Any other questions?
I would just throw in a plug for the virtual testimony. If you're not from around Boston and it's really difficult to get in there, the virtual testimony really is powerful. You're up on the screen, your face is as big as anybody in the room, and people can hear really, really well. So I've seen it just be a really powerful way. Oh, Nan has her hand up.
Hi, thanks, Laura. Oops, hang on. Oh yeah, I'm off mute. I had a question about the DPPC bill. I looked at that more closely and I saw that one of the changes in it is that it would make the DPP commissioners have unlimited terms. And I was surprised by that because two of the current commissioners have overstayed their 5-year term by like 6 and 7 years each. And I don't, given the abuse crisis and the inability of DDS to get a handle on abuse, I don't understand why DPPC isn't doing more and why the commissioners, don't get rotated off so we can get some fresh energy on there.
Yeah, go ahead, Nora.
Nan, I'm happy to follow up with you after. I want to reread the language because I had to read it a few times to see if it was adding term limits or getting rid of them. So let me double check the language and I'll circle back.
Sure. Currently, there's a 5-year term limit with no ability to repeat terms. And for some reason, I think it's Nancy Altieri is proposing that these be, commissioners with no term limit. So they're appointed like the Pope for life. And just given the inaction of DPPC in addressing the abuse crisis, I'm just very surprised by that. And the fact of, how untransparent DPPC is. Like, if any of you can find their minutes online, I would be really impressed because it's very difficult to find their commission meetings online. That's, another concern I have, that they're not very public about their public meetings.
Yeah, that's actually good timing, Nan, because we've been working with them around potentially doing sort of a refresher webinar around the abuser registry. And, at this time, there's 150 individuals on the registry, which is actually more than a lot of states that passed registries around the same time as Massachusetts. So we are making an impact on numbers of people who are unable to work in the community again. The other really interesting stat was that with the abuser registry up and running, there were 22 perfect matches, which means as a person applies for a job and they have to be checked on the registry, 22 times those people were on the registry and were unable to even apply. So we know that the DPPC is doing the abuser registry is doing its job. And, there's actually, some folks that feel like maybe more people are getting on the registry than they should. And so there's a little bit of back and forth around that we're working through. But in general, it's good to see that the registry is up and running so strong. And that we're actually seeing it work with those 22 perfect matches.
Yeah, I agree that Nikki's Law on the registry has been a total home run, really fantastic. Other parts of the DPPC that have been longer term problems, like self-referring so many of the complaints to DDS, where they're then investigating the group homes that they have contracts with. So they have a conflict of interest problem. It's hard
Oops.
to investigate an organization that they have a financial interest in. Did you lose me, Maura?
A little bit, yeah, we did. Let me go to Patty and see what her question is too.
So at first I didn't think it applied to this, but I think it does. So I had to file a complaint for my daughter's residential home because I think we've been away 3 times for our entire marriage, and we've been married a long time. We were away, and my daughter got sent to the emergency room unaccompanied.
Oh my goodness.
And I felt that that was abuse. But the company that runs the residential home and DDS signed off, and it said, no, it was not founded. And I'm still angry about it. It happened last October, but I had no grounds to do anything beyond that. And I don't know if this covers it or not, because I understand Nikki's Law, and I was thrilled that that went through. But I don't know where to address on that one.
Wow, that's amazing to me. I would think like the number one thing would be to have it in the ISP that no matter what, that they have to be accompanied, but how can that
But in
just,
my mind, it shouldn't even have to go to an
no,
ISP. You know what I mean?
no,
It's common sense. She can't
exactly.
advocate for herself. And it was like 3 o'clock in the morning. And
Wow.
what is she doing in there? It's just weird. But anyways,
That's a really good example for us to know and to bring to DPPC, actually. I'll probably follow up with you if you don't mind.
no, definitely, because I'm still upset about it.
Yeah,
Thank you.
sure. Any other questions, Nora, in the chat?
I don't think so. Nan, I'll definitely follow up with you offline. I'll triple check the language. But yeah, any other questions? Well, thank you all so much for being here. Again, we have one more left in this series on July 10th. So if you haven't already registered for that, please do. And you'll get the slides after this. But again, reach out anytime with questions. If you need support on any of this, we are here to be helpful. So happy to keep chatting. Thanks, everyone. Have a good rest of your day.
Be well.